Vitamin D is pivotal in maintaining skeletal health. Deficiency has also been associated with cardiovascular disease, diabetes, and cancer. Understanding how menopause impacts various aspects of health is crucial for creating a supportive workplace. This podcast episode, brought to you by the European Menopause and Andropause Society, features Dr. Panagiotis and Anagnostis discussing the importance of vitamin D for skeletal health and its role in preventing various diseases during menopause. Let's dive into today's discussion.
Hello, dear colleagues. This is Panagiotis Anagnostis from the First Department of Obstetrics and Gynecology from the Aristotle University of Thessaloniki, Greece. In the next 5 to 7 minutes, we will discuss about the role of vitamin D in postmenopausal health. We will focus on the evidence regarding the association between vitamin D deficiency and some aspects of postmenopausal health, such as vasomotor symptomatology, cardiovascular disease, musculoskeletal health, cancer, infections, and of course we will discuss about the effect of vitamin D supplementation on these aspects. First of all, the role of vitamin D in bone metabolism is well known. Vitamin D deficiency is mostly defined as 25 hydroxy vitamin D concentrations below 10 nanograms per ml, and severe vitamin D deficiency is defined as 25 hydroxy D concentrations below 10 nanograms per ml. And there is evidence that vitamin D deficiency, mostly severe vitamin D deficiency, is associated with increased risk for osteoporosis and fractures. However, there is no evidence for an anti-fracture benefit of vitamin D supplementation in postmenopausal women without vitamin D deficiency. In contrast, vitamin D supplementation combined with calcium should be considered in postmenopausal women of any age with low serum 25 hydroxy concentrations who suffer from osteoporosis, or for women who are at high fracture risk according to the FRAX model. In these cases, daily vitamin D supplementation is mostly recommended with doses ranging from 1000 to 2000 units per day, which may be further increased about twofold in obese women. In any case, vitamin D should be combined with calcium supplementation at doses of 1000 to 1200 milligrams per day, either from dietary sources, either from supplements. This combination of vitamin D with calcium should be considered for at least 5 years in order to obtain the optimal benefit for skeletal health. With regard to the other aspect of postmenopausal health, which is cardiovascular disease, there is evidence from epidemiology, from observational studies, showing that vitamin D deficiency is associated with increased prevalence of cardiovascular disease events and mortality. This is mostly attributed to the association of vitamin D deficiency with increased prevalence of cardiovascular risk factors such as metabolic syndrome, type 2 diabetes, and atherogenic dyslipidemia. However, vitamin D supplementation does not seem to have any effect on cardiovascular disease outcomes, as this evidence emerges from randomized controlled trials. There is, however, an evidence for a modest effect of vitamin D supplementation on glucose metabolism, that is, in patients with prediabetes. With regard to cancer, vitamin D deficiency may be associated with increased incidence and mortality of several types of cancer, such as colorectal cancer, lung and breast cancer. There is no association between gynecological cancers, such as ovarian, endometrial, and cervical cancer, as well as with cancer mortality. With regard to vitamin D supplementation, data from randomized controlled trials show no effect on cancer outcomes, whereas there seems to be a modest decrease in cancer-related mortality. With regard to infections, vitamin D deficiency is associated with an increased risk of infections, including COVID-19. Vitamin D supplementation may modestly decrease this risk, particularly the risk of admission to an intensive care unit. However, the high heterogeneity in design, duration, population, and vitamin D dosage among studies must be underscored. With regard to postmenopausal symptomatology, vitamin D deficiency may be associated with an increased risk of menopausal symptoms such as hot flashes, sleep disorders, depression, sexual dysfunction, but the evidence is not robust. It does not derive from studies conducted exclusively in postmenopausal women or in those with documented vitamin D deficiency. On the other hand, vitamin D supplementation does not seem to have an effect on postmenopausal symptoms either as a whole or as individual symptoms, except for a modest effect on vulvovaginal atrophy. In any case, it must be underlined that the vast majority of randomized control trials uh, with regard to vitamin D deficiency were conducted in individuals who were not vitamin D deficient but were generally of good health and at relatively low cardiovascular and fracture risk. The duration of these studies demonstrating a beneficial effect on outcomes such as cardiovascular disease and cancer was relatively short, and the role of potential fluctuations of 25-hydroxy D and parathyroid hormone concentrations in studies that gave high intermittent doses cannot be estimated. Furthermore, the association between vitamin D deficiency and adverse health outcomes may have been driven by confounding or reverse causality, that is, chronic conditions or conditions at the preclinical stage or other factors may have contributed to vitamin D deficiency rather than vice versa. We must also refer to the recently published guidelines by the Endocrine Society, which highlight that there is no need for universal screening or for universal empiric vitamin D supplementation, excluding individuals who are older than 75 years old, in which empiric vitamin D supplementation is suggested because of the potential to lower the risk of mortality. And another issue is patients at high risk for prediabetes, in which, except for lifestyle modification, empiric vitamin D supplementation is suggested in order to reduce the risk of progression to diabetes. Thank you very much for your attention.